The European Commission has reached a deal with drug makers Pfizer and BioNTech to double its order of their COVID vaccine. The move secures the EU nearly half the two firms' global output of the jab this year. The Commission has come under fire recently for Europe's slow vaccination rollout. Here's Commission President Ursula von der Leyen explaining what the deal means for the bloc.
With the new agreement, we could purchase a total of up to an additional 300 million doses of the BioNTech Pfizer vaccine. In other words, this will allow us to double the amount of doses of BioNTech Pfizer.
Let's go right to Brussels. DW's Terry Schultz is standing by for us there. Welcome, Terry. What does this deal actually include?
Yes, Sumi, as European Commission von der Leyen just said, this will double the number of Pfizer-BioNTech vaccines that the European Commission has purchased. And this is not a small issue because the Commission is under fire for having purchased at the beginning too few and too slowly the number of doses that the population of almost 500 million needs. So every additional purchase that they're allowed to make, of course, the Commission will hope that this lessens the criticism of them. And until this week, this BioNTech Pfizer vaccine was the only one approved in the European Union. Of course, earlier this week, Moderna was also approved, adding 160 million doses. And as we listen to these numbers, it seems awfully high, Sumi, but we have to remember that since every person needs 2 doses, you're only going to be able to vaccinate half the number of people that you hear the purchase of the vaccine. So when she says that we're going to have 600 million of the BioNTech Pfizer vaccine, that's going to be, of course, just 300 million people.
All right, that's important to keep in mind. So what do you think this agreement will mean for the EU-wide rollout?
Of course, it's encouraging to know that there will be more vaccinations available, but the problem really hasn't been buying them. The problem is producing them. And the facilities are, in a dead-neck run, producing the drug as fast as possible. But there have been delays both in production and in transport, especially with this BioNTech Pfizer vaccine, because it needs these ultra-cold conditions that not all countries were able to create at the beginning. So some of the shipments had to be delayed. Some of the shipments actually had to be thrown out because they weren't stored properly. The Moderna vaccine can be stored at normal freezer temperatures, so that also will help. But there simply isn't enough capacity to produce the high numbers of vaccines that the public is demanding. Now, also this week, we heard that a new facility to be built there in Marburg, Germany, is going to be up and running for the BioNTech Pfizer vaccine. So that's going to be very encouraging. But as Ursula von der Leyen said this morning, we are only talking about the second quarter of this year for the new Pfizer-BioNTech jabs to come into production, and only by the end of this year will the full shipment be able to be fulfilled. So people need to keep in mind that the rollout is not immediate. You can buy them, but it doesn't mean you're going to have them in your arm anytime soon.
And you have the EU actually coordinating this mammoth task and the member states doing the rollout. So how is that going?
That's right, and I think sometimes it's appropriate to defend the European Commission because they buy them, they purchase them, but it's up to member states to deliver them and implement a vaccination program, and governments are each taking their own path. We've, of course, seen Germany and France criticized for having a slow rollout, but now this week there's some additional criticism, Sumi, and that is that it's been learned that while Germany was president of the European Council the second half of last year, and tasked with shepherding all 27 governments into making their purchases together to have extra leverage to make these big procurements, it also on the side negotiated its own deal with vaccine makers. And that's something that a lot of countries are not happy about. Germany, of course, the wealthiest EU country, a very powerful country, and at the time, the European Council president. So this is something that the European Commission and the German government are being asked about. How was it really ethical for Germany to purchase additional doses on the side? Ursula von der Leyen says that it did not break the European Commission agreement, that countries are allowed to purchase additional doses, and that Germany's extra vaccines will come only after the Commission shipment is fulfilled.
DW's Terry Schultz reporting from Brussels. Good to talk to you.
Deaths from the coronavirus have reached a new one-day high here in Germany, despite an ongoing nationwide lockdown. Figures from the country's public health agency show 1,188 COVID-related deaths in the past 24 hours, and almost 32,000 new COVID-19 cases were recorded. That's a little less than the previous peak in mid-December, but health officials warn actual numbers could be higher. Hans Brandt, our political correspondent, joins me now to talk some more about this. Hans, how do we explain this new record death toll?
Well, the death figures are always delayed by a couple of weeks after the infection figures have peaked. In other words, what we are seeing now are the deaths that are the result of the peaks in infections that were recorded mid-December. It always takes about a week or two before people actually have symptoms. Then it takes a while for them to go to hospital, if they do go to hospital, and then it takes a while for them to die if they do die. So the figures we see now are a factor of the high infection rates that we had in mid-December. And looking at that, this means that the infection rates still are high, and inevitably the death toll, the death figures will continue to be high for at least another 2 or 3 weeks.
And almost 32,000 new infections. Germany doesn't seem to have a grip on the virus. Is this the mutant virus strain hitting the country, or more testing after the holidays, or maybe something else?
Well, the mutant strain hasn't really hit Germany as far as we know. There haven't been that many investigations of to what extent that strain is at the moment present in Germany, although a couple of cases have been recorded. So that's probably not the reason. There is a number of factors that play a role here. Partly it has to do with the festive season and the number of cases being reported now is higher because they were not reported in the festive season around New Year, and there was a public holiday 2 days ago also in parts of Germany. So that's one factor. The other factor is that indeed the number of tests has picked up again since the festive season. But in the end, it means that infection rates do remain high in Germany because the lockdown measures so far have not been as effective as people had hoped.
And with this spike in casualties, the urgency for a rollout of COVID vaccinations is even more pressing. And it seems people here in Germany are increasingly willing to get the jab. Hans, stay with us. We'll talk some more after this report.
Injections to beat infections. Hopes for progress in the battle against the coronavirus are focused on the vaccines. But success in developing them and the accelerated approvals process will be of little use if people won't come forward to be vaccinated. 75% of Germans now say they are prepared to get one of the vaccines. Compared with November, many more people are saying it's not just likely but definite that they will. And the number of people not planning to face the needle is dropping. It's now less than a quarter of the population. Some say that for those who do get vaccinated, rules should be eased. Hotels and restaurants, for instance, could be reopened for those with proof of vaccination. Others think the idea would create unnecessary division. The German public seems to share that scepticism. Nearly 3/4 say the rules should be the same for everybody, even if it were proved that vaccination means people cannot infect others, which is not yet clear. In the EU, the European Commission handled the ordering of vaccines. This was done so that all EU countries could benefit from the bloc's negotiating power, and smaller nations were not disadvantaged. But critics say it slowed the arrival of vaccines and may have influenced the choice of which drugs to buy. Such concerns have not dampened German support for European cooperation. 70% of people think it was right not to have EU nations competing against each other to secure vaccines. Looking ahead, everyone is longing for the end of the pandemic. When will lockdowns, masks and distancing be a thing of the past? Half of Germans think restrictions will be lifted this year, but a third are gloomier, not expecting a return to normal until 2022. And some Germans think corona measures will not be lifted for a long time, perhaps never.
Quite
Quite a lot of pessimism here in Germany. Hans, what are the hurdles and projections for a return to some kind of normality?
Well, I mean, on the one hand, we've seen that the lockdown measures so far have not had the effect that the government and everybody else has hoped for. So the major hope now concentrates on being vaccinated, on a very widely distributed vaccine. And clearly that is not possible at the moment because the supply of vaccines is only picking up very slowly. The government only expects that enough vaccine for everyone will be available within 6 months or so. So the pessimism that we see in these polls seems to be fairly realistic, that the situation is continuing to be serious. It will continue to be so for quite a while, and it will take months before everyone who wants to be vaccinated, even though people do want to be vaccinated, it will take months before they will be able to get the jab and for the situation then to be more relaxed.
Hans Brandt, DW's political correspondent. Thank you very much.
Let's take a look at some other developments in the pandemic now. Germany has broken its record for COVID-related deaths in a 24-hour period. The 1,188 fatalities were also accompanied by a spike in new cases, which surpassed 31,000. The U.S. has reported more than 4,000 new COVID-19 deaths in the past 24 hours. That is a global record, nearly 3 times greater than number 2, Brazil. China has sealed off 2 cities south of Beijing to stem the country's biggest outbreak in months. People are banned from leaving Xinjiang and Qingdai with combined populations of nearly 20 million. And Iran's supreme leader has banned vaccines from the U.S. and Britain. In a televised speech, Ayatollah Ali Khamenei said anti-COVID-19 shots developed in either country are forbidden.